Ever wondered why nausea and vomiting are such common experiences, crossing all boundaries of age, gender, and health condition? Well, these are intricate defense mechanisms of our body, happening at the intersection of various physiological pathways. However, when they become too frequent or severe, they can cause more harm than good. That's when we turn to a group of drugs known as antiemetics. So here we are diving into the fascinating world of emesis, or vomiting, and its management with antiemetics. Let's start with a brief overview of emesis. It's a complex process involving both peripheral and central nervous systems. Various stimuli can trigger the vomiting center in the brain, leading to a series of coordinated muscle contractions and eventually expulsion of gastric contents. Before we dive into antiemetics, let's understand the role of the chemoreceptor trigger zone, or CTZ, in emesis. The CTZ is a group of cells located in the medulla oblongata of the brain, playing a crucial role in the process of vomiting. It is extremely sensitive to blood-borne drugs or hormones and communicates directly with the vomiting center. When the CTZ detects certain substances in the blood, such as toxins or drugs, it triggers the vomiting center, leading to emesis. Understanding the CTZ is key to understanding how antiemetics work, as many of these drugs exert their effects by influencing this particular zone. Stay tuned as we delve deeper into the world of antiemetics in the following scenes. Now, onto antiemetics. These are drugs that help control nausea and vomiting. They do so by acting on different receptors involved in the emetic reflex. First up, we have the H1 receptor blockers. Examples include diphenhydramine, meclizine, and promethazine. They work by blocking histamine receptors in the vomiting center and the vestibular apparatus, an area in the brain involved in balance and spatial orientation. This makes them particularly useful in managing motion sickness and postoperative nausea and vomiting. However, they can cause drowsiness, dry mouth, and blurred vision. Next, we have the HT3 receptor blockers, such as ondansetron, granisetron, and palonosetron. They block serotonin receptors in the gastrointestinal tract and the brain, reducing the activity of the vomiting center. They are commonly used to prevent nausea and vomiting associated with chemotherapy, radiation therapy, and surgery. Side effects include headache, constipation, and rarely QT prolongation, a heart rhythm disorder. Moving on, we have the muscarinic acetylcholine blockers, including scopolamine, hyoscine, and atropine. They block acetylcholine, a neurotransmitter in the central and peripheral nervous systems, reducing the activity of the vomiting center. They are useful in preventing motion sickness and post-operative nausea and vomiting. Side effects can include dry mouth, blurred vision, and urinary retention. Lastly, we have the dopamine receptor antagonists, such as metoclopramide, domperidone, and prochlorperazine. They block dopamine receptors in the brain, reducing the activity of the vomiting center. They are used in managing nausea and vomiting associated with various conditions, including migraines, gastroparesis, and chemotherapy. However, they can cause side effects like drowsiness, restlessness, and in rare cases, movement disorders. So, to summarize, emesis is a complex physiological process that can be triggered by various stimuli. Antiemetics help manage nausea and vomiting by acting on different receptors involved in the emetic reflex. The choice of antiemetic depends on the cause of nausea and vomiting, and each class has its own set of uses and potential side effects. It's indeed a fascinating journey exploring how our body works and how we can manipulate it for our benefit. The world of medicine is full of such intriguing concepts and mechanisms, but remember, while knowledge is power, it should always be used wisely and responsibly. As we close this informative journey into the world of emesis and antiemetics, we want to remind you that your engagement is what keeps us going. If you found this video helpful and enlightening, please show your support by hitting that like button. Also, don't forget to share this video with others who might benefit from this knowledge. We are always eager to hear your thoughts, so please leave a comment below. What did you find most interesting? And of course, if you haven't already, do subscribe to our channel to stay updated with our latest content. Thanks for watching, and remember to always stay curious.